So with this patient, she started noticing a little softer contour around the jawline and the neck and a little bit of weight gain, especially during COVID. What I've noticed is a lot of patients during COVID did put on a little bit of weight. Remember, gyms were closed. People didn't have access to healthy eating or as much exercise as they used to, so they did put on a little bit of weight. Definitely this has resulted in a lot more patients looking interested in liposuction and other type of contouring procedures. But I've also noticed a smaller group of patients who actually had the opposite effect, where they lost a lot of weight during COVID and they had more time and ability to focus on their lifestyle and their diet. And for these patients, they're looking more for surgeries that remove extra skin. So procedures like facelifts or neck lifts or even tummy tucks. Other procedures that I've noticed that have become more popular after COVID include the non-surgical procedures. So things like facial injections and Botox. I guess a lot of people have been stuck at home staring at themselves more often in the mirror or online Zoom meetings or phone calls, and therefore they pay a lot more attention to kind of their facial appearance and how they look on camera.